Welcome to everyone to Planetary Health First, Mars Next. We have an amazing guest here today, and we're going to be taking it off, learning a little more about value based care. And I'm really feeling honored because it's just all about friends, and you have one amazing guest on the show, and then the next thing you know, you get another amazing guest on the show. So today, our special guest Lisa Sherwin, MBA VP of Technology Programs at Village MD. She's done amazing things. She's very involved at Chief First. She's a member. She's a University of Vermont Women in Leadership Program Advisory Board member. And she's been at Village MD for 7 years. So she's seen the beginning, maybe not the first hire, but close, and scaled up. So I would say, how can you do that without someone that's in technology? It's impossible. So I give her a lot of credit, and we're going to learn a lot of what's going on today from her, how it touches value-based care, technology, and primary care. So could you help the audience fill in the gaps? Something, if there's anything I missed about you, Lisa, please fill in a little bit about yourself real quick.
Sure. So I've been in healthcare generally, wow, for coming up on 25 years. So I started with a community health system. I've done consulting. I've been on the software side, really usually sitting at that intersection of technology and operations. And how do you try to make things better for providers and patients? So, it's been a fun journey. Seen definitely a lot of changes in healthcare over the last 25 years. Maybe not as many as we wanted to see, but it's been a fun journey.
So tell us, if you could, why Village MD, and what attracted you to Village MD?
So, I've been here for, like you said, almost 7 years. And I had done a lot of work in the acute care space. I've worked with a lot of the large health systems across the country and saw Village and thought, what a great concept. Really focusing on primary care and focusing on how we keep the patient from actually experiencing those acute episodes, or if they do, trying to keep them out of the hospital. So really backing things up from somebody is already seriously ill, has to go in to those specialists, to the hospital. So how do we keep them well? And really focus on that wellness and focus on good outcomes for patients who really need that attention and really need to understand how to better manage their disease or to prevent it to begin with. And really that preventive care piece that sits in the primary care sphere, really treating that primary care provider as the quarterback, as that person on the front lines, building that relationship with a patient, deepening that relationship, and just making sure that they're connected with them so we can keep people healthy.
Is there anything that surprised you when you started this journey?
There's always surprises in healthcare. It never fails. I'd worked in interoperability for years and felt like we had at least some of it inside the four walls of the hospital. And just the additional challenges with the amount of, we were able to get a lot of payer data, but how you really integrate that in and really see how your patients are doing. And I really think I always thought, who your primary care provider is. They know who their patients are. You would think the payers know who their patients are. But the difference between who a payer says your patient is versus who you feel like your patient is, it can be drastically different. And so I think that is honestly one of the big challenges in value-based care, is making sure that you're truly getting credit for taking care of your patient population and that the payers agree that that is your patient population. So that was definitely interesting. I do remember as well just the sheer number of quality measures that we were having to adhere to as part of our value-based care contracts. And I think we had well over 100 different quality measures. And I was working at the time in operations, really in the MSO with one of our affiliated providers. So this wasn't a huge population. This wasn't a national list. This was New Hampshire, a couple of groups of providers with our contracts. So you take that and you extrapolate it across, hundreds or thousands of providers, which is really where we are now. And it's just incredible. So one of the things that we really did was try to whittle that down for the providers, because they would tell us we can focus on 2 or 3 things. You tell us what we need to focus on, but we can't focus on 100. And when we're in with our patients, we're trying to figure out who needs what quality measures met. And so we really boiled it down to, here's a core set. If you do really well with your diabetic patients, if you do really well with your CHF and COPD patients, and then everything else is what you normally talk to your patients about. Are you, going in for all of your preventive screenings? That, I think, really helped the providers to understand, okay, here's how I can be successful, take good care of my patients without thinking about them as a quality measure, but thinking about them as my patient, but I'm looking at them a little more holistically, but I also know what I need to do so I can really be successful. So those were a few of my early learnings.
I feel like you answered the question like that I posted that I didn't get to ask. So I think you answered a lot of what are some of the keys to success in value-based care. And I'm going to just try to paraphrase what I gathered. You said a lot of good stuff, but really making this data work for providers so they understand it, so it could be actionable and then communicated. And then I hear a real huge barrier that you had when coming into this was payers see one thing, providers see something, and the patient is telling you something totally different. So like that to me is the takeaway that I'm getting from what you're saying, is just the value base is trying to put those silos of mindset into one and show that ROI, deliver that better care.
Absolutely. And as we've grown, I think the interoperability and really making the data work for providers, we've done a lot. We have what we call DocOS, which we named that way specifically because it's what we see as an operating system for our providers. And it's really taking all of that data in. It's an ongoing challenge because payers change their formats on us all the time, and knowing which HIEs should we participate in, how do we get that discharge data so we can get the information to the provider that they need while they're seeing the patient. And I think that unfortunately is just an ongoing challenge. But the more that you can do that, the more you can distill that information so the provider has areas to focus on with their patient when they're in that room and building that relationship. You're trying to do it in a way that you're not getting in between them and the patient. You're not trying to tell them how to practice medicine, but really giving them just some of those prompts on, here's some of the things that we're seeing that your patient is needing, or where they came from, what's happened to them since they last saw you. So they know what questions to ask and kind of how to prompt their patient. Patients, they forget, they don't know exactly when did this happen, where was I? And so the more we can give some of that context for the provider, really just helps them get to those better outcomes.
So how do you guys do the user experience from a technology perspective? Do you have the physicians like advisory board and developing that kind of trying to streamline that experience from that insight? What does that look like with Village MD?
So we have a couple of ways that we do it. We do have a clinical applications team that is really focused on taking that end user feedback and making sure that we're getting better. We have partnership with our EMR provider, and we're meeting with them on a regular basis and really pushing them to improve the provider experience. We do also have what's called, we've called it this dyad of leadership. So rather than having just someone who's focused on operations, who may be that business person, which is a great skill set to have. Physicians don't necessarily enjoy the business of medicine, they enjoy the practice of medicine. So we've partnered them with our national medical directors and providers at all levels of the organization, so that anywhere that there is management of the practice, there is changes to the EMR, there's that input at all levels from providers themselves who have to use this and are the ones who are actually seeing our patients. We've always kind of grounded ourselves in what I would call two pillars: patient experience and provider experience, because really both have to be good.
Mm-hmm.
So that you can, again, not get in the way of the relationship, because it's a very important relationship between that provider and the patient. You don't want to get in the middle of it, and you don't want the EMR to get in the middle of it. So trying to really, get the data to them and get the information to the provider, but in a way in the EMR that makes it easy for them to find. So it's a lot of input from them. It's a lot of work with our EMR provider as well to make sure that they're getting our feedback on a regular basis. And there was just an executive meeting with them where, and their entire leadership team, including their CEO, the head of product, all are getting together and really, really listening to our feedback, which is great, because without that, like, there's only a certain number of changes and things that we can do in configuring an EMR. There are definitely product changes that we continue to push for to support the value-based care and support streamlining the provider experience, so they don't feel like they're doing more administrative work than clinical work.
Yeah, that I really love what I heard with really looking at, you are the facilitation at Village MD of a two-part customer, the patient and provider. And if you don't get both right, you don't get it right at all. I love that. And it seems like driving that from the top all the way through makes you guys really successful.
It really has. And if you look at our founders, Tim Berry, Paul Martino, Dr. Clive Fields. I mean, Dr. Fields has been in primary care for really probably his entire life. His father was a primary care provider. And so we've had a strong and really excellent provider at the table from the very beginning. And I think that clinical input is absolutely critical. They know what their patients are experiencing. They're in the room with them. We put a care team around them who, help support that patient, from care managers, social workers, pharmacists, so that the provider doesn't feel like they have to do everything, but they are in the center of that patient relationship.
Yeah. Let's move over to this other area. Village MD has pushed heavily into value-based care, VBC. We've been talking about that. But as a side note, you guys do government relations too in DC. And why is that? Tell us a little bit more about that.
Yeah, so, the media always has one view of value-based care. The government has a view, and they're always looking to how do we just reduce the cost of care in this country, which is absolutely critically important. But having people there in DC who can say, look, we're successful, we do this really well, and here's the types of outcomes that you can get. Here's why it is worth continuing down this value-based care journey. So things like direct contracting, which then turned to ACO REACH. We had people talking to the legislators about here's what's really happening on the ground. Here's what we've done, bringing those outcomes forward so that they have real data in their hands around real patient experience, real patient outcomes, real provider experience versus just sound bites that they might hear elsewhere or a perspective that's not coming from, again, that provider perspective. So we found that to be really important just in educating, all areas of government around here's what can be done. Here are the types of things that we need to continue to support it and support our patient outcomes and make sure that providers are being recognized for the work that they're really doing with those patients.
Yeah, I love that you are part of this process and the regulatory or legislative and the formation of these value-based care programs in DC. How is that, like, what is the reception to the government with you? Like, how does that dialogue, how is that dynamic? Tell me a little bit more about that process.
Gary Jacobs is absolutely amazing, and he's been in DC for a long time. I think he knows everybody, everyone there. They've been very receptive, again, because what he does is really sit down and talk to them and bring the data to them. Mm-hmm. And that's something that they can really use as they're thinking about legislation, as they're thinking about policy, and having somebody who's willing to sit down completely nonpartisan way and say, look, I don't care if you're Republican or Democrat, which is a pretty bold statement, it seems like, in politics. But, here's what's happening. And mm-hmm. here's how you can really support care for patients in this country. And here's the information, and here's real data that can back it up. And I think that's really one of the keys is, he knows so many people and is able to sit down with them. And when he's bringing good information to them and information that they can use that they may not have been aware of, that's always something that they're appreciative of. So I think he's got a great approach. I absolutely love Gary. And I think he's been very helpful to them in understanding primary care in this country.
Yeah, that's great to hear that you have such a strong advocate that really understands it and really gets that dialogue I think what I should have done earlier, and I'm going to do now, is really, it's almost like an intro. So people that might not be familiar with your model, but just describe your model and what has made you successful in VVC. And let's get into how this technology helps to support your teams.
Absolutely. So our model has evolved, I think, a little bit over the time that I've been here. When I first started, I was in the third affiliate practice group. So we have an MSO, and we still have affiliates where we have a managed services organization. And really that brought three things into our provider practices. We had population health operations, which is really the group helping to distill, here's those quality measures, here's the outcomes. We had the analytics team that was really, they were crunching the data, providing reports, developing, all those algorithms to say, here's who we think is high risk. So we could, the pop health team could really sit down and educate the providers around, here's what we need to do. Here's some patients that we need to address, and work with them on what does this look like? What are some of the programs we need to put in place? And then we also brought a care team. So care managers, I had some social workers so that those high-risk patients could actually get to a care manager who could have a warm handoff from the provider in the practice and then help with that additional education. They have a few minutes in with their provider to hear, oh, you're now diagnosed with diabetes. And now they're like, okay, he told me a bunch of stuff. And what do I need to do? Mm-hmm. So we could have a care manager who could really then help to educate the patient, help to follow them, help to get them through that first part of the journey and come back around if the patient needed more assistance. The social workers did a tremendous job addressing a lot of the other social determinants of health. So people with mental health issues and trying to get them into the right mental health providers, patients who had transportation issues. We actually did a grant at one point with one of the community organizations because transportation can be a huge issue.
Mhm.
New Hampshire has a lot of very rural areas. It's not that you can necessarily catch a bus to get to your provider. And so we partnered to get them car service, to get it basically a taxi service that could bring them to the practice if they had transportation issues. So addressing those social determinants and really making sure we could get the patients to the right care or to their provider, and then those care teams were really key. We moved from affiliates into owning practices in about 2019. And then shortly thereafter, our partnership with Walgreens. We've since expanded we have all kinds of village medical at Walgreens across the country. So if you're in the provider practice and you get a prescription, you're able to just walk through the next door and go into the Walgreens and get it filled.
Mm.
Because that distance from the provider practice to the pharmacy can sometimes be a barrier in patients actually getting their medications. We actually have their pharmacists are able to provide counseling. They'll actually come over, our providers will walk them over to Walgreens so they can get more information about the medications that they're on. Or
Mhm.
have the pharmacists actually look at that med list and say, yeah, you're on 20 medications. We could probably do something a little bit different here, reduce some of your fall risk, reduce the number of meds to help reduce your out of pocket costs. So having that kind of partnership. And then we've expanded with our own pharmacists who will actually call and talk to patients, who actually look at the med adherence and again provide that additional level of support for our patients and our providers so that we can help to keep the patient healthy even after they've left the provider office and fill in some of those gaps and those things that tend to happen once they leave that we aren't aware of until they come back. And you ask, did you take your meds? And they're, well, I couldn't afford to fill them. So we've expanded that. We also have Village Medical at home for patients who can't get into the practice, who may not be ambulatory, may be recently discharged. So we have really put together a broad set of services that help to support the patient. On the technology side, I've talked about DocOS. So we have the analytics, we have a lot of reports, we have what we call some workflow enablement that supports our pharmacists and supports our care and quality teams so that they have more summary information and some algorithms and analytics that are way beyond me that have been run against the data so that, again, we know what actions we may need to take. We also developed, which is really cool, a patient app. It's not meant to be the patient portal, but it does allow patients 24/7 to reach out to an APP. They can start with a chat. It can convert to a telehealth visit. The APP at 2 a.m. can talk to a mother about what's going on with her child and should she go to the emergency room. Maybe she'll be okay till she can get them into the office and can actually schedule an appointment for that patient with their provider. So taking some of that technology underpinning, again, to really enable the workflow and to try to not be in the way of the relationship, but support all of those relationships along the journey, I think has been, I think one of the really cool things that we've done here at Village that you don't necessarily see everywhere. That breadth of services, the technology that sits under it. So it's been a very exciting journey to see all of these things develop over the last several years.
Yeah, no, I hear that, and I think that being able to reach an APP at any time, gosh, it's so anyway, I don't have to say it loud on the air, but it's kind of frustrating to get to your doctor or get what you need, to think that you guys are accessible just like how we do. We text our family, we text whoever, and why can't we text whoever in healthcare? It's like, that's so needed. So that's good you guys are implemented that. And so we're talking a little bit about Summit. That's a big thing. Village MD recently bought Summit, a multi-specialty group. Given your focus on primary care and BBC, how does this align with your model? So tell us a little more about that.
So, at first blush, it looks like, yeah, primary care group and a multi-specialty group, and you've been in value-based care and do all these other things on the primary care side. But multi-specialty really, I think, fits in well to the model for several reasons. One is, many times when you refer a patient out, you don't know where they're going. You try to help guide them to specialists that you know have good outcomes, where they might have lower cost and good outcomes, but you don't always get information back. You don't always get those consult reports. So you don't know if they actually went and saw their cardiologist. You don't know what happened when they did. So now with the multi-specialty group that's connected to us, we'll know where they went. We know they actually got in. We can get those consult reports back much more easily. We also, and I had never really thought about this. I know, you interviewed Susie a few weeks ago, and she's passionate about pediatrics. I'm probably just as passionate about oncology. So one of our oncologists was, meeting with our CTO and really called out, he has lower costs, better outcomes than a lot of the other oncologists in the area, and particularly if you're going to a hospital and the health system, where sometimes you can get a little bit lost. As happened, you and I talked about, it happened to my father when he was going through his cancer treatment. And so that really fits well, like getting that message to the payers that, look, it's not just primary care. We have multi-specialty. It's high quality. We can deliver so many of these things at a lower cost and connected with that primary care provider, so that there's a real whole person view that comes out of it. So, we're just at the beginning of that journey, but I think there's a lot of very interesting, very exciting things to come. Everyone I've met within our Summit team, and we're all really one village at this point, is fantastic and just as passionate about the mission and the patients as everyone that I've worked with at Village. So I think it's really a great synergy between our two organizations, and I think that broader view and really being able to see much more longitudinally with our patients, it can only lead to better outcomes over time.
That's awesome. Do you with what you're I'm curious, like one of the things that I'm hearing is like, when I think of Village MD, and I think this has happened only in the last few years, it's like, are you a provider, are you a payer, or you have home care, you have digital analytics. What are you?
We're all those things, I
Yeah.
think. And if you had asked, a few years ago, I think, there were some points where, well, are we technology, or are we healthcare tech? And really, we are a provider. So we're a national provider of care. Our technology and all the analytics and all the other things that we do are really in service of that. So I could go back to that patient experience and provider experience, really helping to root us as an organization and keeping those patients well, and really helping them in their, really more their wellness journey. Ideally is and keep them well and keep them out of the hospital and keep people healthy and happy and living really, really great lives. So we are a provider organization. We happen to have some pieces of payer because we do value-based care. again, it's in service of that patient and that provider. And, we have all of these other underpinnings. All of it really, sits there in support of that healthcare.
I like how you helped kind of focus me on or help us understand your provider first. And so I think that's what drives, Village MD, hence MD. You've stuck to that, you've kept to that. And I imagine it's been very strategic when you've made the acquisitions, when you've created these partnerships, but it's been helpful to know that you're still always a provider. Have you found being with Village MD, has there been a time since you've been there for 7 years that you have discussed, and some of this stuff I'm sure you can't share, but where do you go with strategic decisions with, should we do this? Should we enter there? Or, just walk us through a little bit of that.
Yeah, so I mean, like any organization, as you're making strategic decisions, it's really, why are we in existence? So what is it that we're wanting to do? And if you, again, really root yourself in, it's, provider experience, it's patient experience, it's helping to keep our patients healthy. So a lot of the things that float to the top are, what is that? Where can we have the biggest impact? There might be something really cool we want to do in technology, but if the providers are struggling with, well, what does it do for me? What's it doing for our patients? Maybe it's not the best direction for us to go. And so I think those decisions really being rooted in, what are we trying to do, really helps to guide and keep us from maybe going down a path of, well, that's great and it's interesting, but it doesn't necessarily fit with, at the end of the day, is this going to help to improve those outcomes? Is it going to help improve the relationship the patient and the provider have? Is it going to make the provider's experience better so they can better serve our patients? So asking those types of questions, I think in any healthcare organization, really is the set of questions you should ask yourself when you're making some of the strategic decisions. There are some cool, great things you could do, but if it, at the end of the day, doesn't get you further down the road and improve lives for your patients and providers, it may not be the right way to go.
Well, it seems like you've articulated what's really helped your focus. I think sometimes we've seen so many acquisitions that just don't really necessarily make sense. It's just to acquire market share, et cetera. And it seems like you've been able to keep it always focused on knowing who your customer is, the provider, the patient, and really aligning that. So it's been successful. And then you're hearing that from the provider. So based on that, how can you fill those gaps? So that's really great. I wanted to come back to the value-based care. So what are some of the challenges now and that you see are coming in VBC or value-based care?
So, I've talked about the ongoing, interoperability, getting the data, getting the information. Again, because we're national in scale, it's not like you can look at one HIE or one small set of hospitals or health systems and say, this is where our patients are probably going. Our patients could be anywhere or go anywhere really at any time. We're, pretty close to coast. We are now up in Oregon with the Summit acquisition. So I think that continues to be one of the areas where, how do we streamline that? How do we get the most information about our patients without having to connect to absolutely everyone? And there are obviously some national initiatives that are underway. And I think as those continue to grow and gel, and as our standards continue to be refined, I know Mickey's trying to do that with ONC and really trying to, how do we streamline this and make this a little bit easier? And I worked with him off and on over the years and know he's passionate about trying to make that easier. So, so I think that will continue to be somewhat of a challenge just in the way our healthcare is structured. But hopefully that I'm
Mhm.
always hopeful
Yeah.
it'll get easier. I've been in healthcare, like I said, for about 25 years, and I've been hopeful for 25 years that it's going to get easier. So we'll see. We'll see what happens. Um, and then, just making sure that the government continues to understand what the value is and how do some of those barriers get cleared to continuing to recognize providers for the care that they're giving, that we aren't holding them to thousands of quality measures, but really focusing in those areas that are important and really lead to good outcomes for our patients. So I think those are some of the areas where there continue to be challenges and things pop up, and you never know what the you know next you know next group in the government's
Mhm.
going to do in the next administration. But just keeping the information in front of them and trying to make sure that they understand where the value really lies.
So you mentioned earlier about the ACO reach. Can you share a little bit with our audience more your involvement and your excitement, or any bit of insight you would like to, and then also from a primary care technology point of view, sort of from you with VP of Technology at Village MD.
Yeah, so Andrea, who heads up our ACO operations, is probably way better positioned. I think she's speaking at NACOS this week. So she probably speaks much more deeply to that than I do. Um, but, I think that's been really exciting for us. We had, I think, the most direct contracting entities of any organization and transitioned that pretty smoothly into ACO Reach. And again, I think we've been pretty successful there. It is exciting and interesting. I mean, the continued challenge is always, who, who do you think our patient is and who is our patient? But but I think there's definitely still a lot of runway for success with that. So it's always interesting. It's always interesting to see what happens and what's coming next. And I know Andrew is very involved in that, and we have some groups who are really passionate about it. I know we've put a lot of pieces in place from a technology perspective around our analytics to really help us be successful and understand what is it that we need to hit on so we can truly be successful in the program. And success for us, like I've said, is not just getting the paycheck at the end of the day, but are we successful when it comes to the right outcomes? And what does success look like for our patients? And I think that being so heavily invested in ACO Reach really helps us to focus on those patient outcomes. I mean, keeping readmissions low, who doesn't want to do that? That, and being recognized for being able to do that well and keep our patients from going into the hospital or keeping them from being readmitted, so that they're getting better care at home, they're getting better care with their primary care provider or with the specialists around them. I think it's exciting to see that kind of recognition of the importance that primary care really plays in the overall health of our patients.
So how do we, there's a lot of naysayers with value-based care. What do you like, if you could give them, like, I get it, like I see XYZ, but what could you do, like the pros and cons, just kind of put that in perspective to what might be the challenges that you see as well?
Yeah, I forget the article I was reading recently that just talked about, is this going to really drive up the cost of care? And I, again, I don't see that within our organization. There's always going to be those market dynamics, at least here in the U.S. Unless we truly go, single payer, which I don't foresee ever happening. we're always going to have that payer provider dynamic, and so there is always that piece around what are the real economics behind it. And I'm, definitely not an economist to be able to sit down and walk through all that. But, it's, I think you have to really look at where the successes have been and how has that helped to drive some of the costs down, and how do we replicate that? And I think one of the nice things that we've done at Village is to us, everyone being successful in value-based care, it doesn't mean we're helping competitors. It just means we're all being successful, that, more patients are getting good care, and we're trying to drive down that overall cost. So I think it's taking some of these models and saying, all right, how do we replicate that? And then how does that truly impact, the cost of care and the outcomes of care? And if we can replicate more of this, what does that really do? And so that's, I like data. I've always liked data. So I always go back to that as, well, let's look at this and let's see what supports it. Let's see where the success has been, and you let the data speak for itself. And there's always changes that can be made that can help to improve it. And hopefully by looking at what's made it successful, not impacting that while you make other changes to continue to drive down cost.
So Lisa, we're coming towards the latter, towards the end of the show. I would love to know what over the next 6 months to a year is getting you excited with projects, initiatives, technology, with, Village MD, and really specifically on the value-based initiatives. Can you share a little bit about that, what you're excited about?
Well, I'm really excited about the integration work that we're doing with our colleagues at Summit, and what we're really going to be able to do as we truly start to integrate our systems and our teams, and so seeing where we're going to be able to really take things from there. It's there's always something exciting and new at Village, which I think is what's kept me around for 7 years. And this is just another, big, exciting opportunity that I think we have that can really have some great impacts on our patients, and really just some cool, fun stuff. Where, I think we'll continue to see how we can pull that into a lot of the value-based care work that we do, and how that can really enhance our ability to be successful, our ability to drive really positive outcomes for our patients. And, I think I shared the story with you before. Like, my father had primary care provider. He was seeing oncologists. I talked to the primary care provider when my father's in the hospital, was asking, do you think it's time for hospice? And he looked at me in complete shock. It had no idea that my father's cancer had spread basically throughout his body. And so if we can avoid, patients and families having those types of events, because our providers and our specialists are well connected and are talking to each other, and that information is truly getting shared across that care continuum. I mean, every family you can save from that conversation, every family that can feel that they have a lot more support and know what those next steps are for their family member. I think every one of those is a success. And, ideally you can pull it back even further, and you can help to prevent some of these events from even happening, so those patients can live much longer and fuller lives, because those care providers are all talking to each other and able to easily share their information. So I think those types of things are what keep me really excited about what we're doing and just about healthcare in general, and where we can really take it and what we can really impact. Because at the end of the day, you know, for me, it's about I've had so many of those bad healthcare experiences
Mhm.
that, to me, anywhere we can have a positive impact and not have those bad experiences happen, that's what wakes me up every morning and makes me come in and go, how do we make this better? And I
Mhm.
realize I'm in technology. I could never handle the blood and everything else that goes with actually taking care of a patient. But what can I do to help move that forward? And what can I do to help support that provider and that patient in some small way? And just keeping that in focus at the end of it. So I think there's some really cool things to
Mhm.
come. I think within Village, but just within healthcare generally, I think there's just a lot more opportunity. And every step along that journey that I see happening is you know one step to just better health for everyone.
Lisa, I loved your story. It's the healthcare is personal. It's personal, and we are all have health. Have loved ones that are going through a situation. And no provider, no primary provider should not know those sort of situations with their own patients, where they are with the cancer journey. It's just, and just that's something like a mantra. I imagine you wake up every day that motivates you. That just shouldn't happen again. It's like, so uh, as we're coming towards the end, Lisa, I'd love for you to share if there's anything that you feel that would be a takeaway, any message you'd love to share. I mean, you name it. This is your time. I really appreciate, first and foremost, for you to be our guest here at Planetary Health First, Mars Next. It's been awesome. I can consider you now a friend. I hope you feel the same way. Um,
Absolutely. Yeah, I think again, I mean, healthcare, like you said, healthcare is personal, and so you know, I just hope everyone who's involved in healthcare is able to keep that kind of focus on, at the end of the day, this is about that patient. It's about that patient's family. So whether it's value-based care and trying to make sure that that care provider and that patient relationship is recognized, and everyone is rewarded better outcomes, and the providers are actually rewarded for the work they're doing to drive down the cost of care. But you know that's only one piece of it, and it's really, you know to me, at the end of the day, all about that patient, and keeping them healthy, and helping them on that healthcare journey, no matter what label we put on it. At the end of the day, that's really what healthcare is about.
yeah. So true. Well, we are wrapping it up today. But before we wrap it up today, I just want to share with our audience, next week, we will be having on Dr. Jenny Bryant and Dr. Z Miriam and they're going to be discussing well-being in the workplace and empowering clinical teams. So much today, we talked about providers. We talked about the patient, from Lisa's perspective, with trying to really make that work. Well, if the clinical team isn't being taken care of, how can they take care of their patients? So I'm looking forward to having our special guest next week. Thank you so much, Lisa, for joining us today. It's been a pleasure to have you.
Thank you. I loved being here. Definitely appreciate the time.
And until next time, friends on Planetary Health, take care. Have a great day.